That gives us some time to settle the conversation on the health. And like we do say, health is wealth. And from the month of February, the Lagos State government have been stepping up gears to ensure that the virus called Corona, which has taken over the world right now, it's on a global level, will not be here in the state and will not be able to bring in any havocs. Okay, now from the 28th of February 2020, the first case of coronavirus was discovered in Lagos. And ever since, measures have been put in place by the Lagos State government in conjunction with all the stakeholders to ensure that we tackle this huge challenge confronting the world right now. As we speak, 117,000 cases discovered globally and 4,251 deaths as a result of this coronavirus. Over 100 countries already affected, and the numbers are growing by the day. But, well, I am a novice in this area, and so the man who's suited to better inform us and take us through this excursion this morning is the Honorable Commissioner for Health in Lagos, and I'm talking about Professor Akin Abayomi. It's nice to have him join us in the studio. Good morning, sir. Yeah, you're welcome to Traffic Radio. Great. I'm trying to see how we can adjust this mic so that we can hear you very well. Okay.
Is this better?
It is getting better, but not fully yet. Let's see how we adjust this. All right. You can talk now.
Okay. Good morning to you and your listeners.
Great. It's nice to have you, Honorable Commissioner. All right. So before we come to the measures that the state government is putting in place to tackle the coronavirus, let's begin by putting to bed the authentic cases of infection as it stands today. How many infected corona cases do we have in Nigeria today?
Well, at the moment, we have two. The index case, which was the Italian gentleman that came in on the 24th of February on Turkish Airlines. And then one out of his contacts has been tested positive. So the total number of positive corona cases in Nigeria as we speak is 2.
Right. Okay. Now, the second case, which was announced this week, that was on Monday, I suspect. Any connection with the first case?
Yes, the second case was a employee of Lafarge, the company that this consultant flew into Nigeria to work with.
Mm-hmm.
He was one of his project managers, and I believe from the story we've been able to ascertain, he spent a significant time with this individual.
All right. Okay, so that's the reason perhaps this is coming up at this time. And what's the latest with the second corona patient, as the case may be right now?
Well, he's on admission in our infectious disease hospital in Yaba at the biosecurity unit. He's in his isolation room, and we're following him up clinically and with tests. And as we run the tests, we will determine his profile
status.
And his status.
Right.
And that will determine how long he will stay with us.
Honorable Commissioner, and some are wondering, why is it that the Lagos State government is taking charge? I mean, this case was discovered in Ogun State.
It's not a matter of taking charge. It's just a matter of, these are very sophisticated tests, and isolation is a sophisticated art. Lagos has a tremendous amount of experience from 2014 when we survived the Ebola outbreak.
Mm-hmm.
Subsequently, we've had multiple challenges in the form of biological threats like Lassa fever, cholera, flu, monkeypox. And we've been developing our capacity in Lagos because of the nature of Lagos. It has multiple ports of entry. It has a very dynamic movement of people in and out, large numbers of animals coming into Lagos for food, a very exponentially bulging population with high density. So we're very vulnerable to outbreak scenarios, either waterborne or airborne. So we know our vulnerabilities, and therefore we've been building our resilience to be able to tackle these kinds of situations early and put them to bed as soon as possible.
That sounds interesting. But let's get back to the index case now, which is the Italian that was discovered on the 28th of February. What's the latest with him? So far, so good.
Well, he's doing very well. He's clinically free of all symptoms, but our tests still confirm that he's secreting the virus. And so as long as he's secreting the virus, even though the levels are going down, he's still contagious. And so while he's well, he has to, by protocol, remain in our isolation unit. until we get a negative. And even after we get a negative, we wait another 48 hours, repeat it,
Right.
because it's not unknown that you can rebound after you get cleared.
Right.
And if you do rebound and we've released you, then you're contagious again. So just to be on the side of caution, we wait for two negatives 48 hours apart. And if that's the case, then we have no longer any reason to hold on to him.
And in terms of his disposition to the infection so far, how is he? Is he high spirited?
Well, he's much better now. There were a number of factors that influenced his mental disposition at the beginning. Obviously, there was a lot of fear. There was isolation. He was the only one in a 14-bed ward. So he was lonely, but we put a lot of things in place. We sent him entertainment. We brought him different types of cuisine. We sent him some artwork that he could occupy his mind. He's writing poetry. We've spent time conversing with him on a day-to-day basis. He sits on his balcony and overlooking a garden, and we can stand in the garden and converse with him for a couple of half an hour or an hour, and that really helps to help his mental state. We also tell him that his viral load is going down, so any moment now. Of course, he's aware that the circumstances in Italy are very dire,
Right.
and so that's something that bothers him. But
So he wouldn't mind staying in Nigeria. Is that what it is?
well, he may not be able to return to Italy just yet.
Okay. All right. Honorable Commissioner, we've been mentioning coronavirus all the while, and I'm sure in spite of the global attention that it has received so far so good, we still have some naysayers who still do not believe that the virus is real. So this morning, I want to just break it down for our listeners. When we say coronavirus, really, talk to someone out there. What is the virus?
Well, the coronavirus, like many other pathogens, it comes from the animal kingdom, and that's what we call a zoonosis. In other words, it's a germ that can jump from an animal, any animal, into the human population. And examples of those are Ebola, Lassa fever, yellow fever, monkeypox, flu. These are all known to be able to move from the ecosystem or the wildlife or any animal. And if you are, as a human being, you're in contact with this wildlife, you are able to receive that virus.
All right.
And if that virus affects you and causes an infection, is one thing, but the other thing is if you can transmit it to another person, then that is the potential for an outbreak.
Right.
So, and a virus can jump from an animal to a human being and not be able to be transmitted from that human being to another human being. Then it's a dead-end infection.
Okay.
But if you can move it from one person to another, then because we've never seen it before, then it becomes a potential hazard for a major global outbreak.
And that's where I want to come in, really, because historically, is there anything that has happened of this nature before in terms of the corona taking spread like it is doing right now?
Well, the same thing happened with SARS and MERS. There are examples of coronaviruses. One was in the Middle East. It came from camels, and the other one was in Southeast Asia. It came from the cat family. So, this is not an unknown phenomenon at all, and we're going to see more and more of this over the future as our environment is negatively impacted by human beings, and as we expand our populations and encroach onto the wild.
Right.
We're going to see this opportunity increasing, and so that's why we're getting ready as a state, as a country, to be able to withstand these kinds of events.
All right. I'm going to come back to the measures that you're putting in place to really withstand this. But the figures are rising on a daily basis, Professor Abayomi. 117,000 cases globally, and we're talking about over 4,000 deaths already in over 100 countries. Let's look through that. Should we be considering this a pandemic already now?
Yes, I think we're getting closer and closer towards pandemic status. The number of countries affected is increasing, its impact on the global economy. All these things are the factors that we take into consideration when we try and define, the magnitude of an outbreak. But for us in Nigeria and in Lagos in particular, you've got to know your weaknesses and your strengths. And we clearly understand that we cannot allow this virus to enter into our highly populated communities of Lagos. So we've been aggressive from the word go. Perhaps the other countries have been a little bit relaxed, and you can see now they're paying for that kind of laxity. But I'm not saying that, Lagos has it all together.
Right.
We're just doing our best. We're being on the offensive, and if we succeed, with the help of the community who have been really very, very supportive, giving the governor all their support, giving me all their support every time we ask for help. The general community in Lagos and Nigeria as a whole have come to our aid. So it's not a Ministry of Health, it's not a Lagos state government. This is a Lagos state, effort.
Right.
And I'm very proud of Lagosians, and Mr. Governor is very proud of the support that we're getting all around.
Lagos Traffic Radio 96.1 FM. All you need to know about the coronavirus is our focus this morning on your side mirror. And taking us to the classroom is Professor Akin Abayomi, who is the Commissioner for Health right here in Lagos State. And he's the Deputy Incident Commander for the coronavirus in Lagos. Okay, we're going to be hearing from you very, very shortly. You will join the conversation. But let me just run you through one or two travel advice. Like we said, if you're navigating through the Ikeja corridor from Ikeja under the bridge, proceeding towards Allen is still very, very good. But beyond that point into Aromire, it gets much busier at that location. From the Allen Junction to Radio down to Coke, busy movement experience within that location too. And if you are also coming in from the Omole end, linking up with Agidingbi, it's a busy but moving traffic experience within that location, right? Do not forget, Eco Bridge from the Alaka end is close to traffic. Lots of rehabilitation work ongoing within that corridor, and movement within that end is very, very busy at the moment. If you want to make use of that end to link up with Apapa, no access for now. Advice is for you to go through Eco Bridge, Ebute Meta, trying to link up with the Ijora end, and then you can proceed on your journey. Okay, Lagos Abeokuta Expressway is still looking busy at the moment. If you're coming in from Ilezik, proceeding towards National, it gets busy at that location. Beyond that point to Airport U-turn down to PWD and Bolade is good, but do not forget construction work ongoing by the Bolade end. Okay, so the line that you used to connect with us in the studio this morning is 0809 912 0777. But do not forget, you can also view us online too. You can watch proceedings of the studio on our website. That's www.trafficradio961.ng. That's trafficradio961.ng. And Professor Akin Abayomi is our guest, the Commissioner for Health in Lagos State. All right, so Honorable Commissioner, let's now zero things down on the measures which the Lagos State government has taken to curtail the spread of the virus. Now, this is going to, how many days now? Like 12 days since we recorded the first incident, and only 2 cases have been announced in Nigeria. I know that, like you said earlier on, Italy is one of the fastest growing countries in terms of the infection rate. Italy, Iran, South Korea, these are next to China. But what are the measures that the Lagos State government is putting in place to curtail the spread of the virus?
Well, I think it's very important that you remember that these measures didn't start last week or a week before. These measures started in 2014. We experienced Ebola, and we know what we went through with Ebola. We didn't want to experience this again. The government has been committed. Ebola exposed our weaknesses in a very profound manner. So we have been building capacity. We've been developing. During Ebola, we even didn't have a laboratory where we could confirm the virus. We didn't have isolation units. We didn't have doctors that were trained in containment. So we've been preparing. Our laws were a little bit deficient. We had no policies, no regulations, no guidelines. So now we've been developing those all through the past 3-4 years. We've built capacity, we've built laboratories, we've built isolation units. So it wasn't a question of if we were going to get another outbreak, it was a question of when. And now we know the when has arrived. And so we were relatively ready. We just had to beef up our preparedness. So under these circumstances, we knew there was an outbreak raging across the world. So our first line of defense was obviously the port of entry. So we, in conjunction with the federal government, remember that Murtala Mohammed International Airport is not a state airport.
Right.
It's a federal airport, and we have no jurisdiction there. But good collaborative efforts between state and federal, we sent in 30 doctors and nurses and an additional 30 a week later. So we have 60 Lagos State health personnel trained and now manning the Lagos State Airport in collaboration with Federal Port Health Authority.
Right.
And so we've tightened that entry port because that's the most likely place that a traveler will come in. Our focus initially was on Southeast Asia, but as soon as the outbreak spread to Europe, we did our mathematics and we know that there's more air travel between Nigeria and Europe, by far more travel, direct air links between Nigeria and Europe.
Right.
So we've tightened our surveillance of the European airlines coming into Lagos.
Okay.
Then, we established our emergency operation center. And soon afterwards, as we discovered that this outbreak was really not slowing down globally,
Right.
Mr. Governor decided to take control of the situation.
Just 1 second, Honorable Commissioner. I know most of you are really trying to connect with us. Just hold on 1 second. We will definitely get to you, but let the Commissioner just drop his thoughts on the measures that the government is taking so far so good. Continue, sir.
Yeah, so based on our advice, Mr. Governor took control of the situation. He became the commander of the incident command system, which is the highest level of control you can have in a state, raising our level of concern. And that also opens up the opportunity for international partners to come in on the fight and partner with us. And that's been happening. There have been lots of support from society, from corporate establishments. So Lagos is really, ramping up. We've got a lot of public awareness going on. We've strengthened all our hospitals, our primary healthcare centers, our general hospitals, so that all our doctors are exercising a high index of suspicion.
So are you saying now that there's no cause for anyone to panic at this point?
No, there's no cause to panic. There's just cause to be alert. We as Lagosians, this is a common fight. This is a joint fight. Together, we will win this battle because we trust in the people of Lagos. They've demonstrated their solidarity for government. Mr. Governor has expressed his satisfaction with the way Lagosians are cooperating with all facets of Secretariat. So I think together we are on a positive and a strong foot.
All right. Okay, we'll talk much more about the equipment and all of that, protective gear for health workers. But let's connect with the people out there because of time constraints now. You can join the conversation right now on 0809 912 0777. That's the numbers that you can link up with us. Perhaps you have one or two areas of concern for the commissioner. You want to bring it to his attention. You can feel free to join the conversation and have the first caller on the line already. Hello there. Good morning.
Good morning.
What's your name?
My name is Kamel.
Kamel, you need to turn down the volume of that radio.
Okay.
Okay, so let's do that so that we can have a smooth conversation. All right, Kamel, where are you calling from?
Right now, I'm at Agege.
All right, so go ahead. You have a question for the commissioner?
Not even a question. I just have to commend the Lagos State government, the way they've been handling this issue of virus. And we should thank God in Nigeria that this thing started from Lagos. If not, only God knows what is the situation in the country now. Just like what happened during the Ebola crisis. If the thing has started from another area, only God knows how many Nigerians will have died because of that Ebola crisis.
All right, so you want to commend the efforts of the government so far?
The efforts of the government, and I speak to them that we should put in more effort to tackle this issue of coronavirus.
All right, then. Thank you so much. You made your point. We're moving on to the next caller. Put your thoughts through. If you have any areas of concern that you want the commissioner to address, feel free to do so on 0809 912 0777. Good morning.
Hello, good morning.
Talk to me. What's your name?
Yeah, my name is Sylvester.
Your name is?
Sylvester.
Okay, Sylvester.
Yeah, I'm calling from Sula anyway.
All right, go ahead.
Yeah, personally, I've listened to the Honorable Commissioner. I don't like this president, but the man has been so sincere. So what I'm hearing from him, it's a very good lecture anyway. God bless him. He speaks from the heart. And let him continue the good job. Because the explanation is very open. He did the whole explanation, the whole lecturing that I so much impressed in my time now that I said, wow, this man is really a Nigerian, being so open, being so sincere in his speech and this, the political statements.
So let me find out for you. Were you one of those that didn't believe that the coronavirus is real?
Yeah, it's right. From what he has said, the way he has done, the only thing they have to improve is on education of how to prevent this washing hands and this thing people have been telling us, so that the campaign should move on a little bit further.
All right.
On the streets and everywhere. So that, but I'm impressed with the Honorable Commissioner. I just want to say thank him. Please, he's a very sincere man.
All right, then. Thank you so much, Sylvester. God bless you too. So we're moving on to the next caller, 0809-912-0777. I'm thinking that you guys will bring in some areas of concern that he will be able to respond to. Hello there. Good morning.
Good morning, Victor. My name is Joke Ziwako.
Nice to hear from you, Joke.
Thank you. Good morning, Honorable Commissioner.
Good morning, ma.
Yes. Well, I am aware that Lagos is saying no, and we can always do more. The area of sensitization, I think, is ongoing, but I think we need to go to the marketplace, to every home, let there be, hands-on awareness. Because the attitude, if anything, if you can teach away the fact that we need to step up our hygiene in terms of hand washing and general hygiene, if that's the only lesson we are going to take away from this corona outbreak virus, then it is a good work. Keep up the good work, sir. We appreciate it. Thank you.
All right then, Biobaku, thank you. We're moving on, 0809-912-0777. You can also link up with us on our social media platform as well. At Lagos Traffic 961 is our Twitter handle. On Facebook, it's Lagos Traffic Radio 96.1 FM. And like I said, we're streaming this live on our website right now and on Facebook. And you can do that on www.trafficradio961.ng. All right, let's hear from you. Talk to me. What questions you have for the commissioner, perhaps areas of concern? Good morning.
Good morning. My name is Abayomi.
Where are you calling from, sir?
From Oregon.
Go ahead.
Please, sir, is there a link between coronavirus and yellow card for traveling? Because I'm aware that there is some people have not been able to travel because they don't have yellow card. They said Nigeria has demanded that yellow card should be presented at point of entry. What's the link between it and the yellow card?
All right, then very good. Thank you. The commissioner will respond to your question. I will take one more before I allow him to respond to all the concerns that you're putting together this first phase of the questions. 0809-912-0777. Hello there.
Good morning.
Good morning.
My name is Adenisi Patrick. I'm calling from Lekki.
Nice to hear from you, Adenisi Patrick.
Thank you. Good morning, Commissioner.
Good morning, sir.
Okay, now the health side of it, the hygiene side of it, that we should all be washing our hands and using sanitizer just to ensure that we maintain good hygiene. Now, after the Ebola crisis, we suspended the campaign. What plans are you putting in place this time around that by the time this coronavirus is conquered, are we still going to sustain the campaign on hygiene so that it will become a culture? And it's coronavirus, deadly as it is, every day across world roads, it is reported that 3,700 people are killed on world roads, which is also a public health issue. Will you be kind enough to also pursue alongside by the time we conquer coronavirus? Good morning, sir.
All right, then thank you, Adenisi Patrick. All right, so Honorable Commissioner, let's have your response to the first set of questions that we have on the program this morning.
Yes, thank you very much to all your listeners, and thank you for all the support you give the Lagos State government. We really appreciate it. To Odeyemi from Oregon, There is no relationship between the yellow card. The yellow card is the yellow fever card that all travelers out of Nigeria should, by law, carry. And you should have your yellow fever vaccine if you're traveling outside of Lagos and, of course, returning into Nigeria. So it's just a coincidence that the federal government is asking travelers now to comply with that regulation that you have your yellow fever vaccine, which is depicted by the yellow card. But there's no relationship between yellow fever and corona fever. So it's not a determinant of whether you are susceptible or vulnerable or in fact have corona fever. The last caller, Mr. Adeniji Patrick.
Adeniji Patrick.
Yes. Thank you. Yes, absolutely. We totally agree. You know, there was a big push for personal hygiene during the Ebola outbreak. It culminated in several initiatives across the state. Of course, yes, there was this time when things became a little bit relaxed. And I think, you know, during the cholera outbreak, the initiatives started to pick up again. There are several initiatives going on. For example, in the schools, there's a massive drive to rehabilitate all our primary and secondary schools in Lagos State, with particular emphasis on access to water and sanitation and ablution facilities. Generally speaking, we want to educate all our children in schools about personal hygiene, not that as a reaction, but as a culture. You know, you wash your hands before you eat, you wash your hands after you go to the bathroom facilities, you wash your hands when you come back into your home, and you just generally exercise good personal hygiene. So it's something that we're driving. There are several initiatives like the WASH initiative, the school initiatives, and of course in the health sector, water and sanitation is very important, and we're rehabilitating our primary and our secondary hospitals to make sure that one of the major components is the access to good flowing water and hygiene within these medical facilities.
Right. Lagos Traffic Radio 96.1 FM, Ikorodu Road, busy movement coming in from Asolo, proceeding towards the Mile 12 corridor down to K2 Koshofe. It's busy but moving traffic experience within that location. All right, there's an SMS which I munched during the course of the week when we were doing the coronavirus advocacy, and this one is coming from Tolani. He sent this on WhatsApp, I think two days ago, and he said, "Good morning, Victor. I still find it difficult to believe that coronavirus is here in Lagos. If it is true that it is so, why is the Lagos State government not willing to disclose the identity of the index case?" What would you respond to that, Honorable Commissioner?
Well, you know, there is what we call medical ethics and patient-doctor confidentiality. It's not in our purview to be able to release personal details of our patients. These patients are under my care in Lagos State, and I am unable to release the information according to our ethical principles. We would only release information like this if it poses a state of or national security issue. And again, that would be beyond my control. It would be something that Mr. Governor would have to take up with the Attorney General and decide whether it is worth,
Put it in the public domain.
Putting into the public domain personalized data. You know, that would be an infringement of personal rights. You know, we as medical personnel cannot do that on our own.
Yeah, but some school of thought would have equally said, if this happened in the other side of town, perhaps in other countries, they would have disclosed this if this happened to a Nigerian.
Well, that would be a breakdown of personal human rights in that environment, and it's just because they can do it doesn't mean we should do it. I don't know of any situation where, unless it's a security issue, where personal information is released to the public.
All right. Let's get back to the phone lines right now. Still get some more feeds from our listeners. 0809-912-0777. Please turn down the volume of that radio. Hello there. Good morning.
Hello, good morning.
All right. So you need to turn down the volume of that radio, or else you will get a yellow card, and perhaps that's just what happened. All right. So talk to me. Hello there. Good morning.
Hello, good morning.
Okay, so like I said, that's what happens. Before you put that phone across to callers, just please turn down the volume of that radio so that we can have a very good communication. Good morning.
Hello, good morning. My name is Oluyinka.
Olayinka.
Oluyinka.
Oh, Oluyinka. Where are you calling from, madam?
I'm still driving. I'm on the top Milan Bridge, but I have to call because I have some concerns regarding this coronavirus.
Good. So go ahead.
Yes, my question is, good morning to Professor Abayomi. Kudos, we really appreciate your efforts, sir. Now, you said that the index case, the Italian man, if he's no longer secreting the virus and started for 48 hours, will be released. Is it possible for him to test negative after being tested positive?
Okay, that's your first question?
No, yes, that's my question. I really need to know.
Okay, all right. Thank you, madam. All right, so maybe just respond to that right away before.
Yes, so let me just explain again. When you're positive, you're secreting the virus in your respiratory tract, so in your throat, in your cough, sneezing from the back of your throat, and you can transmit that virus to other people. In other words, you're contagious. We keep you in our isolation facilities until we are quite sure that there are no more viruses in your respiratory tract. So we take samples from your back of your throat, from your lungs, just to make sure that we can't find the virus in those secretions.
Okay. All right, then. Let's take some more feeds from you. 0809-912-0777. Still on your side mirror this beautiful Wednesday morning. And we are having a conversation with the Commissioner for Health. Good morning.
Good morning. My name is Adenike.
Adenike, where are you calling from?
I'm calling from Yaba.
All right, go ahead.
Yes, I wanted to ask concerning this.
Now, Adenike, please, you need to turn down the volume of that radio.
It's not on.
Okay, we're having a howl back from you, but go ahead quickly.
Can you hear me now?
It's better.
Okay. I wanted to find out because there are a lot of information out there that's not true. We don't know which one is true, which one is wrong. Now, people say that a black man, African man can't get the virus. The second person that caught the virus that he was in contact with, the project manager, is black, he's African.
Okay. All right. Very nice question. Thank you. So, Professor Abayomi, is that correct? That black people can hardly contact this virus?
Well, so far we do have situations where people of African origin have contracted the virus. There's a Cameroonian, there was someone from Nigeria in Washington, and we have a case here with us in Nigeria. So there is no solid scientific backing, and of course this is a new outbreak, so Africa hasn't really been tested.
So you can confirm that the second case is a black person? Right?
Yes, the person who contracted it is from Nigeria.
Okay. All right, then 0809-912-0777. Gradually heading towards the finish line on the program this morning, but we can still hear from you. Anything that relates to the coronavirus. Hello there, good morning. Hello?
Hello.
Yeah, good morning. Go ahead. What's your name?
Good morning. This is Ayo from Papa.
Go ahead, Ayo.
Yeah. Good morning, Prof.
Good morning, sir.
Yeah, well done, sir.
Thank you.
My concern about this is the possibility of the spread, God forbid, if the other contacts that are still at large are not traced. Looking at our transportation system in Lagos, where we sit in downpour and we are packed together in sweating and breathing and coughing and sneezing on each other, is the Lagos State trying to collaborate with Ogun State to make sure that these contacts are traced and brought to quarantine, okay, so that our fears can be taken off.
Thank you so much. Thank you, Ayo, for that question. So, and in line with that, I mean, what's the latest with the contact tracing that the government is doing with the index case?
Yes, so with the index case, we've identified all his contacts, from the airline to the hotel he stayed in, to the factory he worked in Ogun State, to the transport system that's used to move back and forth. And all of them have been traced. As of yesterday, we just had difficulty finding two that were left in Lagos, and we've identified them through the help of social media and the press. So we are following up all the contacts, both in Ogun State and in Lagos State, and they are completing their 14 days of isolation tomorrow, after which, unless there are any symptoms, we would have no reason to continue isolation. That means we would have hopefully broken the cycle of transmission from this index case. But time will still determine what will happen. We seem to have limited the virus's opportunity to enter into the community through this very aggressive contact tracing process that we've embarked upon with the help.
And what about your health workers? How safe are they in terms of attending to the two cases that we have right now?
Well, they are trained, retrained, and trained, and trained, and trained. So they are really experts in this field. They don't take chances, not like during the Ebola outbreak, where we really were not too confident about what we're doing. Now we put them through training periodically. So these are experts in their field. They work at Yaba Infectious Disease Hospital. It's not a place that anybody should just wander into. It's a high security facility.
Right.
And the doctors and the health professionals that work there are extremely professional and well trained.
Professor Abayomi, it's nice having you in the studio. So your parting thoughts to our listeners this morning in terms of what we should do as citizens, what would be your response?
Well, the most important thing is not to panic. The second important thing is not to spread fake news. Having said that, the fake news seems to have stopped, but right at the beginning, it really tested us. I can't say I was thankful for it, but it showed us that our system was working, because with every fake news item that came out, we went out into the community. And it also showed that we really have a robust network in Nigeria, in Lagos particularly.
Right.
And with a lot of community intelligence. So keep yourself clean, keep yourself safe, follow the instructions we give, personal hygiene. If you're sick, stay at home. If we issue instructions, follow them, and most importantly, keep being the cooperative Lagosians that you are. Mr. Governor is very, very, very happy with the response of the public, and so far, together, we seem to be winning.
All right, then. We have to leave it at that for now. Thank you so much for being here, Honorable Commissioner.
Pleasure. All
right. So I've been speaking with Professor Akin Abayomi, who's the Commissioner for Health in Lagos, and we've been trying to bring to you all that you need to know about the coronavirus. But we must go now. Mike James has produced the program this morning, and maximum time goes to, I'm talking about Ogunbanwo, that's Olatibosun Ogunbanwo, who's Director of Public Affairs for the Ministry of Health. Thank you so much. Titi Akosa, also in the building, and Kewe Akpo Kinovo, also in the building as well. We must appreciate you. All right, so we must go. The social media team, thank you so much for adding your voice to the conversation. And also to our executive producer, Tayo Akonle. Your side mirror returns tomorrow when we look at another issue that relates to the environment. But till then, this is Victor Oteri. Stay safe. Bye.